Hello, Dr. Jeff Johnston here. Today I would like to talk to you about saliva, or commonly known as spit. Um, this is a very important part of the oral cavity. Your spit or saliva is composed of buffering systems, enzymes, many good things to help you start digestion, to help you clean your teeth. It's just a very important fluid in our body. Our body is made up of incredible chemistry, and the saliva in our mouth is the most important part of our mouth sometimes. Um, Saliva helps us, it has an enzyme called salivary amylase, and it actually helps us start breaking down our foods right as we're eating. It helps dissolve foods, it makes foods soft. So digestion actually occurs in the mouth while we're chewing. Saliva also buffers our mouth, so our mouth has to stay at a constant pH, and a pH is, I don't know if everyone's had basic chemistry out there probably, so it's acidic and basic. It helps us stay at a relatively neutral pH. A lot of times we eat sour candy, foods that are acidic such as Cokes, and saliva can help us buffer our mouth back to that normal pH. It's called critical pH in our world because once we drop below that pH in our mouth, teeth start to break down. So our saliva is there to help our mouth stay in a neutral pH. Other things, the sodium bicarbonate is found in our saliva. That's a buffering, helps with pH. Also, our saliva can be more liquidy, it can be thicker. The liquidy is better. The thicker is it doesn't wash and clean the teeth. Back in the caveman days, the saliva is all we needed. Now we're eating carbohydrates and chips and candy and stuff that's getting real sticky on our teeth, and the saliva is having a hard time washing that sticky stuff off our teeth, so that's why we need to incorporate toothbrushes and floss and stuff like that. So I just wanted to reiterate, that saliva is really important. And what's happening out there is a lot of people are taking medications, and most medications, a side effect is to dry the mouth. It's turning off the saliva glands, and it's just not a good thing for our dental health. Really watch the effects that medications are having on your teeth. A dry mouth is not a good mouth. We need nice, moist, liquid saliva covering our teeth at all times. We produce up to 1 liter of saliva a day. These saliva glands in our mouth are just extremely important. And if you have any questions over medications and interactions with saliva, there's also medications that help you increase saliva flow and rate and production. Just a lot of things going on with these tiny glands that are just so important to our overall health of our mouth. So give me a call, come by if you have any questions over saliva. If you feel like your mouth's too dry, I would say drink a lot of water, chew sugar-free citric candies. Always make sure your mouth is moist and wet, so the teeth is bathing in some good solutions and not staying dry. This is very common with elderly patients. They're taking meds for so long, it's just wiped out their salivary glands. If you have any kind of radiation in the head and neck, it can kill salivary glands. These glands are just extremely important for the health of our teeth. I'll see you next week. We'll talk about another topic that whenever I wake up I think of these topics, so I like to keep it fresh, and we'll go from there. Thanks. Bye-bye.